journal. It was titled as Knowledge, Attitude, Practice Towards the Use of Emergency Contraception Among Women Living in Saudi Arabia. That was published in World Family Medicine in September 2021. And I was supervising a group of my students. I really thank them very well for their participation and their input in this particular activity. In general, my presentation will be very well focused, starting by quick introduction, followed by methodology which we have used to produce this article, results, and the discussion which we have gone through, and at the end, references. So let's start. It's a very common problem present worldwide, which is unintended pregnancy. And it was found that in the MENA region, which indicates people or the area covered by Middle East and North Africa, this issue is present for almost 25% of pregnancies. Well, what is the solution? Part of it is going to consider unsafe abortions, because in most part, up to my knowledge, in MENA, abortion is not legal. Or to continue this pregnancy and to have it as something with the bad emotions all the time, and that would have its consequences and its impact for the mother and also for her future baby. So what to do if the intimate relationship took place and there was no good contraceptive method? A very easy solution is to go for emergency contraception, where the process of implantation of the fertilized ovum will be interrupted. And if the technique is used correctly, then the success rate would reach up to till 98%. Okay. Is it possible to go for this pathway, which is the emergency contraception? Yes. It's very well known. It has its own techniques in the form of using progestin-only pills by a specific dose. And it is advisable to go for it within the first 24 hours after the unprotected intercourse. However, if we take this technique, the side effects are quite high. The most important one is extensive and excessive nausea and vomiting, to the extent that the medication which stays available for the body to work locally at level of the endometrium will be quite limited. The second solution is to use the combined oral contraceptive pills. And again, in a specific high dose and specific regime, they should be taken almost 12 hours apart, 2 doses, preferably within the first 24 hours after the unprotected intercourse. And the success rate is quite high, reaching up till 95% if the course is followed well. The success for the COC is higher than POP simply because the side effects is less compared to the progestin-only pills. The third system which can be implemented is insertion of loop. The advantage of this system that it can be successful up till 5 days after the event. All right. So that was the theoretical part of the utilization of emergency contraception. And the aim of our study was to assess the knowledge, attitude, and practice of using these methods among the women living in Saudi Arabia. And the most important thing is the women who are having this issue. What we meant about that, we want to take or to study women in the childbearing age, somewhere between 15 to 45 years of age. Here is the list of the researchers. It was me plus my 4 students. I really thank them for their input and effort. Our sample was cross-sectional, non-randomized, convenient sample. We utilized an externally validated survey, and we have sent this, this questionnaire online to the participants. We were having a specific inclusion criteria. We were taking only females who are living currently or at time of study in Saudi Arabia, and the age group should be somewhere between 15 to 45 years only. We have utilized the SPSS version 22 as our statistical system, and the level of significance was taken as equal to 0.05. We did calculate the sample size by using the G-Power software, and the criteria is having effect size of 0.3, the alpha is 0.05, and power is 0.95 with degree of freedom. Now, let's see what was the outcome of such intervention. We have collected a total of 234 responses. We found that 233 were eligible for further analysis. So these were taken and the analysis was carried out. One of the respondents was 50 years of age, so her response was removed from our statistics. Now I'll just show you the results with extreme focus. Here is our first result. If you can notice that most of the respondents were somewhere between 36 and 40 to 45 years of age, followed by the early interval in childbearing, which is from 15 to 25 years. As expected, most of the respondents were Saudis. It was almost 90%, and most of the respondents were married. The others were unmarried, either they are single or divorced. We were accepting that. Simply we were checking the knowledge and attitude. We were not asking our participants if they have practiced this issue or no. So it was okay to have married and unmarried respondents. Most of our respondents were having university and higher level of education, and most of them they were unemployed. I would say 1/3 of our sample was unemployed and 1/3 are employed. The others, or almost the last third, were students in the different levels of education. These were the questions which have been used in our survey. We were asking about our respondents if they have heard about such thing. Is there anything known as emergency contraception? Do they think that it is effective? Is it safe to use it? Is emergency contraception a technique for abortion? Is it abortifacient? Is it something to induce abortion, or is it something before the true abortion definition? And we are really interested in this question. And we found that a significant number of our respondents were not having good knowledge about it, and they don't know what's the difference. If you can notice here in this table, 64% of our respondents, they don't know if it is one technique of abortion or something before abortion is considered. And we were asking our participants or our respondent if they think that this system will prevent the sexually transmitted disease. And again, the knowledge was not clear, and most of our respondents say they don't know. And also, since the Saudis, they belong to Islam as a religion. We asked them if they know if it is allowed or not allowed. Again, the division was almost equal among having no idea about its real about the decision in Islam whether to use it or not, and those whom they are sure that it is not forbidden in Islam. Again, we were asking them about what technique they are aware of. Most of them, they were not sure about technique used for emergency contraception. And regarding the interval, again, they don't know what is the correct interval to use the emergency contraception, and what is the best dosage or the best technique, they don't know as well. About the way to get the tool for emergency contraception, 60% or 56% of our respondents, they were taking it from pharmacy. So we were really glad that our respondents, they know that it's legal and they can find it easily as over the counter. They can have self-order for it and they can pick it up easily from pharmacy. We were asking about if they have used it or no, and if they were recommended to somebody else. Most of our respondents, they were not sure if they were recommended to somebody else. And we were really interested to know about the source of information. We found that equal among media about health practitioners, and also taking the information from a member of the family. We were asking also about the situation in which use emergency contraception, and it seems that most of our participants, or half of them, they know that it is good after after being raped, after having unprotected intercourse, or if there is an issue with the contraceptive technique like missing pill or torn barrier contraceptive. When we have looked at the analysis, if there is any difference among these different parameters which were taken, we did not find any statistical significant difference among the several types which were studied. And really, that was not a surprise for us, because when we have done some form of review of the articles which have studied this issue locally, that was almost similar to the outcome present over there, and there was minor improvement in the knowledge. Such topic was of interest for local researchers for the last 10 years, but over this interval, there was minor improvement in the knowledge regarding the availability of this technique legally in the market, and about its value and utilization for the patients whom they needed. And that was making us very clear that there is still need for more action to educate the women and to educate the community about the presence of this technique, about its legality, whether from religious point of view and also from clinical practice, it's allowed, even from governmental practice. And we have noticed that there is lack of knowledge even among practitioners to disclose this information to their patients. So maybe we need to consider other ways to educate the community about it, by using scholars of the community, by using the social media in educating the woman about presence of this technique and their legal right to use it. We have to keep in mind that our study had involved a small portion of the community. It was only 233, so the number is quite small. And the nature by which we have carried out the study was basically online over short interval. The whole sample was collected over 4 weeks. And the nature of the study, it was basically cross-sectional. So maybe there is a chance for having or a recommendation to make larger studies over a longer period and to involve more participants in order to receive more valid, more strong conclusions. So that was our recommendation per se, just to go for large-scale studies and to educate the healthcare practitioner to discuss this topic openly with their patients as part of their rights. Here is the list of references which we have used in our review. And I really thank you again for giving me this opportunity. I hope my presentation was short, focused, and of value for everybody. I'm ready for any question you would like to ask. Thank you.
Thank you, Dr. Rehab, for this informative presentation. Any question for Dr. Rehab?